Hello, I'm Dr. Mark Wortman from Summit Family Dental in Shelby Township, Michigan. This is the next video in our series to communicate directly to you topics that we often get questions about. This video topic is about bruxism or teeth grinding. Patients will often complain to me about waking up from sleep with a dull headache or a sore jaw. They'll often tell me that they find themselves clenching their teeth together. They're not alone. The American Dental Association reports that 40 million Americans grind their teeth. That translates to 8% of adults and 25% of children. Many people are unaware that they grind their teeth because they do it while they sleep. Bruxism will often occur in the early part of the night and may disturb sleep because it can be quite loud. Headaches, earaches, toothaches, sore facial muscles, and damage to the jaw joint can result from bruxism. The effects on the teeth can be very destructive. The outer layer of the tooth, the enamel, can be worn away, exposing the underlayer of the tooth, the dentin. This can cause sensitivity and tooth nerve damage. The pressure from clenching and grinding can cause teeth to loosen and fracture. So now that we've discussed all the negative consequences of clenching and grinding, what can we do about it? Regular dental checkups are the best way to detect the damage in the earliest stages. This picture here shows bruxism when it's left unchecked. During your checkup exam, we can look for wear patterns on your teeth and check for any tenderness in the muscles and your jaw joint. It's also very important that you discuss any symptoms or concerns that you may have with us. An excellent screening tool is the Panoramic Radiograph. This X-ray, when taken at appropriate intervals, can show irregularities in the temporomandibular joint. It can also show bone remodeling along the mandible where the main muscles that are overworked during clenching and grinding will attach. The first radiograph here shows a mandible with no irregularities and it's considered normal. The second radiograph here demonstrates marked remodeling along the angle of the mandible from the primary muscles responsible for clenching and grinding. In addition to a radiographic exam, the dentist will also palpate or feel the muscles involved in bruxism. The muscles are often overdeveloped and sore to the touch in someone who grinds their teeth. Based on your examination, we may recommend a custom fit night guard, which is shown here. The night guard fits over the teeth and prevents contact from the opposing teeth. This can help relieve pressure on the teeth, the muscles, and the temporomandibular joint. Many patients experience significant relief when they wear a night guard. It'll also prevent future damage to their teeth. Fabricating a night guard is simple. It requires only dental impressions and a bite registration. Stress can also be a contributing factor to bruxism, as well as some medications that patients may take. We may also recommend warm, moist compresses on the sore, stiff muscles, and also a stress reduction protocol. Taking time to exercise and sleep properly can reduce bruxism symptoms. There are some patients that may need additional treatment provided by a specialist in temporomandibular joint treatment. These treatments can include physical therapy and adjustments to the teeth and the bite to help the teeth fit together more appropriately. Please feel free to discuss any needs or concerns that you have regarding bruxism at your next checkup, or you can schedule a consultation with one of our doctors. Thanks so much for watching, and thank you for choosing Summit Family Dental. We look forward to seeing you at your next appointment, and we always appreciate your referrals to our office.